Hi everyone, my name is Lauren Sisto and I will be applying the SAMR model to nursing simulation. There is often a distance between theory and practice in nursing education that can complicate the learning process and nursing concepts. A common method of filling these gaps is through simulation in the nursing lab. Simulation is a process where clinical practice is approached as closely as possible. Real-life scenarios can be completed with guided experiences so that students can experience their future roles. The lessons taught in the classroom can be applied to practice, and mistakes can be made without causing damage. Nursing schools have simulations integrated into the curriculum, and students must be competent with these skills before moving on to the next concept. Simulations are often performed on peers, but integrating technology can advance the assignment. Created to help in planning and assessing levels of technology used in the classroom, the SAMR model allows the educator to evaluate the level at which students are using technology. This model encourages the students to learn the technological skills needed in the 21st century. The acronym stands for substitution, augmentation, modification, and redefinition. Under the category of enhancement, the technology introduced does not change the task itself. Substitution does not make any functional change, and augmentation provides functional improvement. Under transformation, the task is changed significantly to integrate technology. Modification redefines the task, and redefinition creates new tasks. Taking the simulation of a head-to-toe assessment and adding in the technology of a low-fidelity mannequin. This learning tool still acts as a patient for students, but still does not allow for the abnormal data. Low-fidelity mannequins have minimal ability to replicate human responses and are limited to task training. These type of mannequins are great for practice, but it can be difficult to suspend the disbelief in these simulations. In significantly changing the tasks to include technology, high-fidelity mannequins are beneficial to simulation. High-fidelity mannequins are full body and computerized to replicate the anatomy and physiology of a real patient. Many can talk and replicate a wide range of human responses. High-fidelity mannequins can simulate realistic patient effects like heart sounds, breath sounds, chest movement, and blood pressure. This technology can teach critical thinking skills and practice reflection. The use of screen-based computer simulators would redefine or modify the simulation task. Screen-based simulations, best used with entry-level students, allow them to experience a variety of medical skills and procedures. These are designed to model human physiology, and through these programs, students can make clinical decisions and observe the results in action. Students can practice with basic skills at their own pace and receive feedback during and after the interaction. Simulation programs are relatively inexpensive, are reusable, and can be used individually or in groups. However, these programs are not very lifelike and should not take the place of more realistic simulations. Redefining simulation could be done with virtual reality. Virtual reality can provide multi-sensory experiences for the learner in a computer-generated environment. VR uses computer technology to create a three-dimensional world where users can have spatial presence. This provides active learning in first person through different degrees of immersion. VR has been found to be highly conducive to clinical and procedure training. It can incorporate physical interfaces, speech-voice recognition, motor sensors, or haptic devices. Simulation allows educators to teach in a safe environment. They can provide feedback in real time, even pausing the activity for discussion and correction. Educators can also choose to record the simulations to provide more detailed feedback to the students. They play a significant role in simulation and can facilitate learning with their knowledge and skills. On the other hand, the ability to start and stop simulations can impede the student's ability to learn and does not reflect real-life situations. Educators should be trained in simulation processes and technological issues, which may add extra workload. Ineffective training of educators can prevent simulations from being a smooth operation and a true learning experience for the students. If simulations are poorly designed, it may result in negative learning. Simulation can promote teamwork and solidarity among students. With direct feedback from the educator, it promotes clinical reasoning and critical thinking. Students are becoming more familiar with advanced technologies and may find comfort in these types of simulations. This allows them to practice their skills, make errors, and repeat the process until they reach mastery. Simulations done in smaller groups allow students to directly monitor their classmates and improve their own methods. Since simulations are not real life, students may not pay closest attention to detail. When students need to then apply these skills in practice, they may become more stressed and be unable to complete the procedure. Within the time constraints in simulations, students may fail to assess for important details in the healthcare process, like consenting to a procedure or not following the rules of communication. The attitudes of students are an important part of successful simulation. If I was integrating new technology into simulation, I would recommend virtual reality. VR for simulation has been shown to be an effective tool for nursing education. It has gained increased attention and has been used to teach leadership, communication, decision making, critical thinking, and disaster triage. VR can provide repetitive hands-on training to develop cognitive skills and mastery, which can measure the student's understanding of concepts and procedure demonstration. While there are many advantages to VR, some research has shown that it is not more effective than other traditional methods of simulation. However, student participants in one study recommended VR for nursing education. At this time, it may be best to have VR as a complement to other simulation strategies to improve quality and safety in clinical practice. Some of these different methods of simulation are already being used within nursing education. With the use of the SAMR model and the different forms of simulation, students have the potential of gaining a more comprehensive understanding of patient care. With any proposal for change, there may be resistance from educators. It is important to work with the educators to overcome these barriers. All components of the model should be discussed with the other educators. They should be allowed to ask questions and be provided resources to better understand the different technologies. The educators may feel more comfortable with the model and the technologies if they experience them firsthand. Having a solid understanding of the different forms of simulation will allow for a better educator and student experience. Simulations can improve healthcare and patient safety and are important to student knowledge and experience. Integrating these technologies into education can allow students to become more successful nurses. Thank you.